I'm Dr. Adrian Dreessen. I've been an emergency physician practicing for just over 21 years, and I'm an emergency doctor here at Brookings Health. They have some form of identification, some maybe a list of past medical problems, or at least medicines. It's helpful to know allergies, and then it's also helpful to have somebody with you that you trust and can be like your memory or your memory from the past or memory from instructions going forward to help with the visit. Triage is a way of sorting, sorting is the best way to put it. So we use a patient's presentation, their presenting complaint, say chest pain, short of breath, abdominal pain, and then combine that with vital signs, meaning temperature, heart rate, rest rate, oxygen and blood pressure, to help decide who's the sickest and probably should be attended more quickly and who's not. Also, I guess, put in there is trauma, but that's another entity on itself. If you have visited an emergency, often you have to tell your story multiple times. So often it's the intake nurse who gets those things: chief complaint, vital signs, and maybe a little history on what's going on. And unfortunately, often the provider may come in and do those same questions. Sometimes people get frustrated with it, but it's usually just somebody's trying to get a story about what exactly was going on. It may expand on one point, may not be as interested in another point, and it just kind of leads to exactly what's going on with the current medical problem. Both being courteous, meaning trying to help the patient get their medical problem checked out first. I think we also follow EMTALA obligations where anybody can present if they believe they have a medical emergency. They need to be seen by somebody, taken care of, and then we worry about the money, insurance stuff later. What we try to do is put together a picture about a patient's health. And so it could be, even on site, you may see somebody who's pale or, what we call cyanotic, meaning blue discoloration because not a lack of oxygen. It could be they're cool or clammy. Often people that are sweaty, that may lead to there's an underlying problem that can't be seen from the outside so far. So I think we combine our vital signs, our gestalt about what we're seeing and feeling, along with physical exam, plus tests to help decide what the patient needs most appropriately next. Depends on the patient's, age, what they're there for, vital signs, and what appropriate treatment needs to happen, whether it be no tests, diagnostic tests such as labs, x-rays, CT scans, even up to the level of needing to see a specialist, or then somebody may be transferred to another hospital in order to get that care. It's a cumulative story about what happened with the patient's visit, what the results are, what we think's happening, and then what we expect to happen going forward, and whether that includes prescriptions or a follow-up with a doctor or whatever that entails. We try to go through that verbally, which is why I think it's important for somebody to come with somebody who can have a memory of that with them. But also we have discharge instructions to try to get patients to reiterate what we have talked about. I think that depends on what it is exactly, such as pain. If it's unbearable and they don't have the right treatment plan or medicines to take care of it, they may need to be re-seen. I believe our discharge instructions have our emergency number, department number, and so somebody is welcome to call back. I think that they can also speak to their own doctor or whoever's on call to get a call back and help decide what's the right next plan for them. I think we have great trained providers, nursing staff, and also ancillary staff such as lab, x-ray, CT techs to pretty much take care of anything on the front end. I have some data to say that within about a 75-mile radius around our facility, we have some of the fastest throughput times getting the patient from the front door all the way to discharge or admission. We also, I think community-wise, I think the whole community comes together to take care of our emergency patients. And so I think it's helpful to have those other staff that are available in case something's needed to take care of.